afternoon. This is Servando Garcia. He works at UCI Irvine, and I'm going to ask him a couple questions. Okay, first question. Who supported you on pursuing your career?
My parents and my older sisters.
Second question. What obstacles did you go through?
Not having a car and getting to school on the bus, that was an obstacle, but I got through it.
Why did you choose this specialty?
Because it's giving back to the community, helping people in the medical field is very rewarding as well.
What do you do if a patient refuses care at the risk of his or her own safety?
That's their risk, but we explain the risks and benefits, and we go from there. But most of the time, it's very rare we come across something like that.
Okay. Third question. What would you do if a physician questions the accuracy of your work?
They have the authority to do that, just like we have the authority to do that to them. But if there's any type of question, we go over it, to clear things up.
All right. Fourth question. How do you like to be recognized for your hard work?
I don't. It's my job. It's what I wanted to do, and regardless whether they they acknowledge me or not, I know that I'm a good nurse, and I think every nurse out there that I have worked with, they're all very good nurses.
Okay. Fifth question. What are your biggest job motivators?
My mentor, which was Abby, one of the older nurses that trained me.
Okay. Sixth question. How do you try and create a great patient experience?
How?
Yeah.
By giving the best care possible without judging anyone.
Okay. Seventh question. What promoted you to become a nurse?
I think in the beginning, because my brother was sick and he was in the hospital for over a year, and because he had polio, so I was pretty much being babysat at Chalk Hospital for over a year when he was there. So he went through like 20 surgeries. So I came across, all the healthcare and nurses, respiratory therapists, and physical therapy, and so I kept seeing that throughout one whole year, or maybe even over a little bit over a year. So that kind of encouraged me to become a nurse or get into the medical field.
Okay. How do you deal with stressful work situations?
I think that you have to learn how to handle any type of situation, especially in an emergency. You have to think fast. You have to act, calmly, and not stress out. Because if you do, then you're gonna end up making the situation worse.
What is being on call all about?
Being on call is we take call in our dialysis unit, and my specialty, we take call once a week, and that is we work 3 12 hours. So out of those 3 days, you take call once, which is your last day, and you're on call after you clock out. So we go in at 7 a.m., we clock out at 7:30. After 7:30, you take call for 12 hours, and the next morning, whoever is on will take over.
Okay. Am I going to make good money as a nurse?
Well, if you're just thinking about the money, you should not get into nursing. If you, it is good money, it's well paid, and it's very rewarding. So don't look at the money only.
Okay. Is it better to work with children, adults, or the elderly?
That you will figure out once you get into say my specialty or as a nurse. It opens up your doors to so many specialties. OR, ER, dialysis, GI, cardiology. It opens up to many things. OR, even pediatrics. So you pretty much find yourself liking a certain area, after your training.
What is it like to lose a patient?
It's hard. It's heartbreaking, not just for you, but the family. It's sad, but you can't take things to the heart. yeah, we are humans. We do have feelings and stuff, but you can't take it personal, because then it's gonna drain you as a nurse.
What can I expect from my first nursing job?
Um, I could only say at UCI they expect a lot. You'd learn a lot. You have to be open minded. It's nice working at a university hospital because it's a teaching hospital, so you learn from other residents, fellows, and the doctors, and from other nurses, and they're very well trained for the most part.
What is nursing and what do nurses do?
Nurses, we are motivators. We're educators. We are we are patient advocates, and we give comfort care. We care for patients. We try to be there for them.
How can I become a nurse personally?
I think that you should try to, if you're really into say the medical field, try to take the anatomy, physiology, all these prerequisites, and then try to research a little more, or even do a what's called a volunteer work at a hospital, and see if you like it, or follow a nurse, as a volunteer, or just work at a hospital and see what the situation and the setting is like, and see if you like it.
Okay. Just how undervalued and underfunded is nursing?
I don't think it's underfunded. I think we're understaffed sometimes, and for the most part, these big hospitals, they're very well funded, most of them. State funded or federal government funded, or there's private institutions, so they're well paid. For the most part, they're well managed and well paid.
Okay. What are your short-term and long-term career goals?
Well, my short-term goal was to finish school. My long-term goal was to get my bachelor's. I got, and then I continue. Nursing is always about learning and learning more and more, and it just keeps going. And anything in the medical field, there's always new things coming up, and they train us on it, and we learn about it. We put that in work.
Do you intend to get an advanced nursing degree?
I have an advanced nursing degree already. I have a bachelor's. I'm working currently on my master's as an MSN. It's called a Master's of Science in Nursing, which is a little generalized. But I think I want to teach, but I'm not really sure 100% if I want to do management or teach.
Okay. What college did you attend and why?
I attended a community college, Santa Ana College, which I got a full ride after, because I used to run track. And then after that, I went to University of Texas, Arlington, and to get my bachelor's. And now I'm thinking of applying to Costa Long Beach for my master's.
Okay. Do you, I don't know, what kind of nursing degree do you need to do the work you want to do?
All you need, all you need is if you go through a community college, you get an ADN, an associate degree in nursing. Then a lot of these hospitals are becoming, they're actually asking you to get a bachelor's. So a lot of them are asking for a bachelor's. They prefer a bachelor's for you to apply, but not necessarily. But I think that you should advance your career. If you want to become a nurse, get a minimum bachelor's.
Bachelor's?
Mm-hmm.
What do you think could motivate me in becoming like a nurse? Or
I think you should thrive to become a nurse. If that's what you really want to do, you should do it. Don't have second thoughts about doing it. It's rewarding. It's awesome, especially the schedule, because you work 3 days, you're off 4 days. It's very there's so much you can do. It opens up your doors to so many. You can do, like I said, you can do different specialties. You can do travel nursing, which I did in the past when I first started about 17 years ago. And you can go from different hospitals, different states. You have contracts, and you're traveling. And they pay for your room and board, plus you get paid as a nurse. So it's nice. So if you're thinking about it, I think you should do it.
Okay. So far, like being, how long have you been a nurse for?
Total 17 years.
Since how so far, how do you like it?
I love it. That's why I'm still in it.
Okay. Well, thank you guys. This is Servando Garcia from UCI. There, you can cut it.
Alrighty.